Welcome to the Postpartum Performance Podcast. If you're here to be empowered and encouraged, you're in the right place. I believe every woman deserves to learn who's in her corner, which is why this podcast was created, to share encouragement and intentional conversations around women's health, nutrition, and wellness for new mothers. In each episode, we will discuss ways for women to find truth for her health, to feel strong, and to be confident from the inside out. I'm your host, Dr. Lindsay Peczkowski, a performance physical therapist with a passion for teaching others about pelvic health and guiding mothers to build movement, confidence, and strength. I'm a lover of running and weightlifting and a healthy cooking enthusiast. All right, ladies, grab your coffee and settle in for an episode of the Postpartum Performance Podcast. Are you with me? Here we go. Hello, welcome to today's episode of the Postpartum Performance Podcast. Today, I have a wonderful guest, a good friend of mine, Jenny Kessler, and she is a family nurse practitioner in the San Diego area. Today, we're going to be talking about knowing your options. So talking more specifically on vaginal health, what's normal, what's not normal, birth control, and how it goes beyond the pill, and also some family planning and knowing that you have options, and so much more in this episode. Jenny is such a wonderful person, and it was so great to chat with her. A little bit more about Jenny. So Jenny is a family nurse practitioner in San Diego, California. She went to Azusa Pacific University for undergrad and UCLA for graduate school. Prior to working in primary care, she was a pediatric RN at Children's Hospital in Los Angeles. She's married to her wonderful husband, Reed, and enjoys their snuggly Labradoodle, Bodie. And she's currently 37 weeks pregnant at the time of the interview that we recorded. So super excited for her and her family. In her free time, Jenny enjoys hiking, camping, and exploring new cities. Not necessarily now during that global pandemic, but in general enjoys traveling. And she enjoys reading a variety of books. She's currently working in a primary care in a community health setting. The patients she primarily works with are ages 14 and older, and a large part of her practice is young and middle-aged women that she really enjoys working with. She also serves as a sexual and reproductive health clinician representative for her organization to help bridge the gap between primary care and women's and men's health issues. So a lot of great stuff in this episode. Thank you so much for tuning in. Let's get going. Welcome, Jenny, to the podcast, the Postpartum Performance Podcast. So excited to have you on today and just talking a little bit more about women's health and in your scope of practice. So before we get started, I thought it'd be good to have you share a little bit about yourself personally and professionally, and then also just some stuff that you're passionate about within your profession.
Great. Yes. Well, thank you, first of all, for having me on, for inviting me. I think, so I am a family nurse practitioner. Before I entered family practice in the kind of the preventative healthcare, primary care setting, I was a pediatric RN up in Los Angeles at Children's Hospital, Los Angeles. And in my current practice, I mainly see patients like 14 years and older. A large part of my population are women coming in for unrelated women's health issues or specific related women's health issues. But I would say women's health is definitely an interest of mine. And I think there's a huge need for bridging the gap between, general primary care and women and what they are needing specifically. So yeah, that's what I like to do.
Awesome. And how did you get interested more in the women's health to go from a pediatric nurse into more of the like family practice and more of that women's health side of things?
Yes. I get that question a lot. When I became a nurse practitioner, it was my goal to do more comprehensive family care. So not just pediatrics, not just kids. And then honestly, the women's health kind of just fell into my lap. My current job, I kind of took over for a women's health clinician. So there are already a lot of women coming into the clinic that I got to assume care for, which is great. And I also want to say I'm not an OB-GYN. I do a lot of gynecology, but again, it's really, I love that idea of bridging that gap of, primary care, general practice, in extending that into gynecology, because there's a lot of overlap there that gets missed a lot.
Oh, awesome. So that we'll actually kind of dive into some of our like main topics for today. So we're going to talk a little bit about vaginal health, some family planning stuff, and kind of the topic of birth control. But why don't we just jump right into some of that like vaginal health type of stuff and just general like women's health, kind of like the basic level of things. What would you say is normal for kind of vaginal health, or like normal things that people are coming in for, or when you're seeing some of that abnormal, that someone's coming in for something and then you see, oh, this is going on. This is actually something that, you might need some treatment for, or you might need to address with whatever that might look like.
Yeah, absolutely. I would say the most common concern that women come in with is, I'm having this vaginal discharge, or it just kind of feels different down there. And, are just concerned about what could be possibly going on. So I think, before we jump into this, it's really important to understand, like, what is normal? Like, what is normal vaginal discharge? Because that can even range. For women, it can depend on, where you're at in your cycle. It can depend on just your personal body anatomy, genetics. It's normal to have up to from 1 to 4 ounces of vaginal discharge per day. That is normal. That seems like a lot when you think about like a shot glass of vaginal discharge. Not to get too descriptive. Well, we're actually going to get a little descriptive here, but so yes, that is normal. Normal discharge can range from like clear, transparent, kind of sticky, to more like white, thicker, again, depending on where you're at in your monthly cycle. The abnormal things I would be concerned about is, if you're having obviously discomfort, like pain with sex, itching or just irritation, or if there's, like a greenish yellowy discharge. And also, if you're having like, all of a sudden like just copious, like lots and lots of discharge, then I would want to get that checked out. But as far as the most common types of vaginal infection, majority, well, I won't say majority, but a large percentage of women end up having bacterial vaginosis. When we talk about vaginal infections, it's we're thinking about the pH balance of the vaginal canal. Surprisingly, the vagina does a pretty good job at like managing itself and kind of keeping that balance. But when the pH environment in that canal kind of swings one way or the other, it can lead to infection. So with BV or bacterial vaginosis, it allows for an overgrowth of bacteria. On the opposite side of the spectrum is yeast or Candida overgrowth, causing a yeast infection. I would say some of the signs with BV is typically an odorous, a bad odor. Is kind of described as like a fishy odor. Can have more discharge, not too much. Like sometimes women will have some like irritation, but it's not really itchy. It's mainly that odorous discharge. And with yeast, on the other hand, you're going to have more thick, white, kind of cottage cheesy discharge, maybe even less discharge, but usually itching and the irritation is really common with it.
Do you find that between those two types, like women postpartum or kind of women in that ballpark of things, more often than not seeing one over the other, or is it person dependent?
Yeah, it's definitely dependent on the person and the circumstances. With postpartum, immediately postpartum for a couple days, women experience the lochia, which is that kind of more rusty, bloody vaginal discharge, which is completely normal for a few days after delivering, specifically with vaginal deliveries. But we also have to think about like kind of all the hormone changes that are taking place postpartum that can also play a part in making you more prone to infections. And good peri-care, using the peri-care bottle that they give you in the hospital is important for keeping the area clean. Yes, absolutely.
Mm-hmm.
I will say, as far as like preventing infection and just kind of maintaining good vaginal health, essentially outside of, like sexual activity, avoid putting anything into the vaginal canal. So that means like douching, even like when you're like just kind of cleaning, nothing needs to go into the vaginal canal. Like I said before, that vaginal canal does a pretty good job at cleaning itself and maintaining that balance. If anything does go into the vaginal canal, make sure it's clean. If you're, sex toys, whatever you're interested in. So yeah, douching, avoid other things that can make you more prone to frequent infections. A lot of women come in like, man, I just, had bacterial vaginosis or yeast infection last month and now it's back again. So things we think about, smoking, being overweight can increase your risk of these infections. If there's some sort of underlying disease, there's a huge list of things that could be contributing. That's why it's super important to make sure if you're experiencing any of these things, go get it checked out with your clinician. Let's see here.
And in the training that I've had too, with some of that like hygiene and stuff like that too, is to be mindful of some of like the soaps and the body washes. And, like you don't need to be like sudsing up that area, that just like warm water is okay and stuff like that too. Cause taking a look at kind of what we're consuming or what we're putting on our skin can definitely play a role. I'm sure if some people have more sensitive skin, that area as well.
Yes, absolutely. You really want to stay clear of like fragrances and body washes with like dyes in them. So, your Bath and Body Work type things, just be really cautious with, maybe avoid in the genital area. Mild soap and water is really all you need, and just on the outside, nothing inside. And also like bubble baths. That's a really common trigger for infection and irritation. So
interesting. Any recommendations for the active moms out there? So the ones with their, yoga pants, athleisure, some of that stuff where they might maybe be squeezing in a workout and then going to pick up the kids and doing a different things throughout the day, with kind of the clothing that they're wearing or what they can do.
Yeah. So you definitely want to be, try to, if you're in, more sweaty attire, try to change out of it after working out. Keeping that vaginal area clean and dry is super important. So avoid, going to pick up the kids in kind of sweaty, especially tight, leggings. And then cotton or moisture wicking material is also super helpful for those active moms.
Awesome. And how often would you be recommending people to go in and see someone like you, or just for that kind of like vaginal health and wellness, women's health kind of wellness checkup?
Yeah. There's a couple of different recommendations out there and philosophies. Definitely going in for your pap smears is very important. And current guidelines, depending on your age, it's at least every 3 years now. It used to be every year that is not the case anymore. And granted, you don't have any history of abnormal pap smears. So that's kind of like a guiding principle for checkups. And then, anytime there's anything abnormal, but kind of going in for your annual physical can catch any concerns or abnormalities that need further follow-up.
So I wanted to touch on now some of the birth control, family planning, things like that. So when you have patients coming in and they're talking about maybe wanting to start a family, or if they already have a child, but they're trying to kind of plan what their next steps are you helping kind of consult them on that? Or kind of what advice do you have for people looking for kind of that family planning within your scope and kind of the people that you're seeing?
Sure. Yes. Yes, I'm definitely talking about that. And that's kind of one of those bridging the gap things I was talking about earlier, where, women, this is something we have to think about, when do we want to get pregnant? Do we want to become pregnant? How often or how many kids do we want? How far apart do we want them? Super important to be thinking about and planning for. And so, yes, I do definitely talk about this and consult with my female patients. And so there's a couple different things to think about. And every person is in a different, spot in their life, and there's different values or priorities that are pressing for them. But in general, it's when we look at the guidelines, the World Health Organization actually has a very long recommendation. They recommend 24 months, so 2 years between pregnancies. And we also have to think with the World Health Organization, they're also they're also talking to more third world countries and other things that have a lot of other issues that we don't really have to think about here in the US. But with the American College of Obstetricians and Gynecologists, they recommend trying to get to 18 months in between pregnancies. And the reason for that is, any woman who's been pregnant knows that it is rough on the body. Lindsay, I'm sure you see kind of the aftermath or like issues after pregnancy in the pelvic floor. So really rehabbing and letting the body heal and get strong in between pregnancies is important, something to think about. And then also, there's a lot of research and studies that show that if shortened periods between pregnancies can increase risk of outcomes and decreased outcomes and problems for both mom, baby, and issues during the pregnancy. So really want to think about planning out those pregnancies if possible.
Mm-hmm. I think that's huge too. With like some of the women that I do work with, they're like, well, I know I'm going to have 3 kids, or like they have that kind of in their mind of like, I had 1 kid, we're going to have, we want to have 2 more kids. And some women just think like, well, my body's going to go through this again. I don't need to recover to the same extent or get back to that strength or that like physicality level. But it really is super important for the actual next pregnancy and labor and like moving forward for long-term health, which I find that so interesting. And within that 18-month or 24-month time that you're able to do that, then on the side of more of like the muscles and the function and the core strength again, but then also looking more like physiologically and some of that the other side of the coin for more of that just general health long-term and for health for the baby too. So I find that really interesting. With those recommendations, they kind of pair in together for that.
Absolutely. Yeah.
So for birth control specifically, I know there's, like different types and forms of birth control, and there's definitely, everyone has kind of their different opinions. But I feel like as for you, Jenny, being a practitioner, that you have to kind of show the options, and depending on kind of where that person's from or kind of where they're coming from and where they are and what they're looking for, you might kind of guide them in a certain direction. But in general, I guess what the difference between hormonal and non-hormonal birth control and what that looks like, and recommendations and anything to be aware of when choosing a form of birth control, and potentially like future situations of like any impact on health, whether that's to get pregnant again or to get pregnant or anything like that.
Yeah, absolutely. So, goodness, there is so much to talk about here. I feel like I could talk all day about this. Yeah, there are so many different types of contraception, birth control out there. And I'm always so surprised. A lot of women don't know all their options. And so, yeah, I love kind of, my role, my job is to, present the options, educate my patients, so they can make an informed decision about what's best for them and in their lives and their situation, according to their values and just what they're looking for. So, if you're not, if you think that birth control means the pill, go talk to your primary care provider or keep listening, because I'm going to talk about all the different options. But yeah, oftentimes I'll have women come in and like, oh, like, are you interested in birth control? Like, oh no, I took the pill, didn't work for me. Like, oh, well, let's talk about all the other options. Let's find something that does work for you. Yeah, I guess when, with all these options, it's really important to think about, like, what are you wanting in a birth control method? Is it like, I just had a baby, I don't want to get pregnant. Having a really effective birth control is super important. Or maybe, you have heavier periods and you're wanting something to help control the periods and also provide that pregnancy prevention. Or maybe you're just bad at taking or thinking about taking a pill every day, or thinking about your birth control on a regular basis. You want something that's more long acting, or hormones. You're concerned about the effects of hormones, so you're wanting a non-hormonal birth control option. So those are kind of some of the things that we think about when I'm counseling a woman on helping them choose the right method for them. I'll start with kind of going down the list. I guess the most effective birth controls. Those are going to be, obviously abstinence. It's pretty hard to get pregnant with abstinence. But in addition, or aside to that, you're looking at your longer acting birth controls. So those are, your IUDs and your implant. So some brand names that you may have heard of, like Skyla, Mirena, the Paragard IUD, or the Nexplanon implant. These are very, very effective at preventing pregnancy, up to like 99.9% effective. With the IUDs, those are those little T-shaped devices that actually live in the uterus. They're placed in your health practitioner's office. Pretty quick procedure. I would talk to, again, with all of these, please talk to your personal clinician for an individualized plan. But the IUDs, they used to get a really bad rep back in like the 70s and the 80s, I believe. Just they had a lot of complications and issues and infection issues, but we've really come a long way. A lot of my patients really like these longer term methods. And let's see, the next one, that implant, it goes in the fatty tissue of your arm. Again, super simple procedure done in your office. A lot of women like that because it can last up to 3 years. The IUD, depending on which one you're looking at, can be anywhere from 3 to up to 10 years. Other common birth control methods, these are kind of ones that you have to think about on some sort of regular interval. So obviously you have your pill. There's both the combined pill that has estrogen and progesterone in it, and as well as the progesterone-only pill. Progesterone-only pill is it's great for that postpartum period. If you're breastfeeding, you want to try to stay away from estrogen temporarily. But again, you have to think about taking a pill every day, especially with that progesterone-only pill. You have to think about taking it at the same time every day. It's very kind of time sensitive in how effective it is. I would say there is like a up to 9% risk of getting pregnant on the pill. And that's mainly from imperfect use, like forgetting to take it, not taking it at the same time. So there is an increased risk of getting pregnant, more so than those IUDs and Nexplanon. Other ones, you have your depot injection. That's every 3 months. You go into your clinician's office for the shot that lasts up to 3 months. With the depot, if you're thinking of becoming pregnant in the next year, I would probably think about a different option, because that is the one that can delay your fertility a little bit, or your return of fertility. With all the other options, your fertility returns to what it was before you started the birth control. And then you have the patch, the vaginal ring, like the Nuva ring. And so the patch you change about once a week. The Nuva ring is once a month. So again, got to think about it, put it on your calendar. And as long as you're organized like that, that could be a really, those methods could be really good. Then obviously, you have your condoms, both male and female condoms. There are female condoms out there too. A lot of women don't know about those, but we're trying to make them have a comeback, because women can be more in control of using condoms if they're using a female condom, meaning it goes into the vaginal canal.
Does that have the same effectiveness too as the one for the male too?
Yeah, it's roughly about the same.
As long as it's used appropriately.
Yes, exactly. That's the key thing.
User error.
Is it used? Are you remembering to use it? And then, you run the risk of, does it, same with male and female condoms. Did it tear? Did it or break? Or did it fall off or out? So yes, user error does run that risk. And then, the withdrawal method, or the pull-out method, also user error. And we're talking up to, 20 to 25% risk of pregnancy with the condoms and withdrawal method. If perfect use, it's much, much lower, maybe 3 to 5% risk of pregnancy while using condoms or withdrawal. But again, we have to think about the practicality in the real world, heat of the moment, things that can go wrong or forget or whatnot that can increase that risk of pregnancy. And then also the fertility awareness-based methods. So your cycle beads and basal body temperature measurements and whatnot. These can be great for women who are super organized and aware of what's going on in their body. Even back to the vaginal discharge of, there are different ways of measuring the consistency as your discharge changes throughout the month, that can give you clues to when you're most fertile and to avoid sex during those days. And, again, that's why I say it's great for super organized women or who are very, in tune with their bodies and their changes, that would be a good method for. Otherwise, we see a high user error with those methods as well, up to 25%. So that's a quick kind of rundown of everything.
That's awesome. I think it's really helpful for our listeners to kind of know that there are more than options than just the pill, and kind of even like thinking about like your personality type and where you're at in life and what kind of your future planning of, whether that's family planning or not family planning, kind of knowing where you're at on that can help with deciding that. And also, like you said, talking with your practitioner for your personal approach and the best plan for you. I think that's huge.
Yeah, absolutely. Absolutely.
That's awesome. Thank you so much for that insight, Jenny. So the next thing I wanted to talk about was something that I think kind of a big reason why I wanted to start this podcast was I feel like there's a lot of the conversations that I've had with women that come into our clinic. There's so much about like, I wish I would have known this sooner. And that in regards to pelvic health, physical therapy, and just kind of what I do. But I know that even within all of women's health, there's so many facets to that I think a lot of women don't necessarily either talk about, or it's after the fact, or they've been, around having certain symptoms or certain things for so long. What's something that frequently comes up for you for women in your clinic of something that I wish I would have known sooner that you can maybe shed some light on so that people that are listening might be able to hear it sooner and not later, on whether that's a certain diagnosis or a certain symptom or a certain preventative thing, anything like that you've come across in like women's health topics?
Yeah, I think at least in the conversations with my patients, oftentimes the most surprising thing I think is kind of this topic that we've been talking about is family planning and the different options that are available to women, and how important that is. I think a lot of women who might be listening, may have had the experience, they go in for their annual physical and none of this is ever even brought up. So that's why it's, so important to, for clinicians, from my point of view, to be asking women, like, what are your family planning goals? Like, you had a kid a year ago. Are you interested in having more kids? When? And just helping women think through that a little bit. And that's often surprising when I ask those questions. They're like, no one's ever asked me about this, or no one's, given me the options of how to plan through this. So, which is just a shame from my perspective. It should be definitely being talked about more.
Mm-hmm. I think something to touch on that as well is like with our sexual health and education that's kind of coming through in some of the schools and sometimes not always in the schools, but when it gets talked about, are some of these things that really are like helpful, like even just like the normal kind of hygiene and health, and not some of the taboo of some of those areas of our body. Any like resources or things that either, people that you would recommend to kind of look into their stuff, or recommendation type resources that you guys have for handouts or anything like that? Because I think that's so important, is that educating our patients and our clients and women just in general, like through this podcast, we want people to just know. So if there's any resources that you would recommend, or certain topics about that, of just, thinking about even just like girls just at the beginning of starting to get their period and different things, and helping them kind of become one with their body, and then knowing there's so many options and things available that might not be what's deemed as the standard, or kind of that type of thing.
Yeah, absolutely. A lot of times, especially with my adolescent patients, they're getting their information from their friends, who are also teenagers, and there's just a lot of misinformation out there. about how their bodies work and what to expect. So yeah, absolutely. So I would say the most important thing is finding a healthcare clinician that you feel safe asking these questions, or better yet, they're asking the questions to you. Because it's often not comfortable for women to bring these things up. So I think from a healthcare provider's perspective, we need to be doing a better job at asking our patients and bringing up the conversation and the education piece of this. So we can kind of redirect some of the misinformation that's out there. And then as you mentioned, that kind of taboo or just kind of discomfort with our own bodies or even talking about this, there's a lot of a growing movement of, being familiar with your body. Don't be afraid to take a mirror and kind of look down there if you've never done that. It's part of your body, and that way you can know what your normal looks like. So if there isn't any changes, any skin discolorations or lesions that pop up, or irritation, redness, you know what it used to look like and what it looks like now. So as far as resources, I would say if you want to learn more about the different contraceptive methods, I like referring people to bedsider.org. They have a lot of great resources and education pieces. So that's super helpful.
I'll put that one in the show description to the link to it so people can see that one. Perfect. The other thing I wanted to, I don't know if the listeners, we didn't touch on, but that you are actually pregnant 37 weeks and so exciting with your first. So super excited for you guys and you and your husband and for your growing family. And how has your personal experience with your pregnancy, has that changed anything with kind of your mindset with the patients that you're working with, or even just making some things more real, or like anything with that now? Previously being more of a women's health practitioner, and then now you're kind of going through some of those things that your patients have been experiencing.
Yeah, absolutely. I should have mentioned that in my introduction, but yes, I am technically due it any day now. I would say my own experience with this pregnancy, oh goodness, I'm a trained medical professional, and I've been shocked at all the pregnancy symptoms that I've experienced. Somehow I thought that I would be immune to these symptoms. I was so surprised when I was so nauseous and fatigued in my first trimester. I'm like, why is this happening to me? Oh yeah, it's because I'm pregnant and that's normal. We're like within the norm of possibilities. So I think as I've personally have gone through this experience, it's given me, a greater understanding for my patients who I work with and counsel, of what it's like for them as they manage their own families and job and life, while being pregnant. It's also been, I will say, it's been very interesting being a pregnant healthcare provider in the context of a global pandemic. I've been doing telehealth primarily. And, when you're doing telehealth, people don't see below your chest.
They don't see the belly.
And so a lot of my patients actually don't even know that I'm pregnant, which has kind of been just a different kind of mindset that I didn't imagine that my pregnancy would be like. I thought it'd be something that I would be able to share with some of my patients. So that's just been something interesting to navigate and notice about my experience. But I will say it has been fun when I do have pregnant women seeing me via telehealth. I'm like, oh, by the way, I understand. I'm pregnant too, so I understand what you're going through. Just to have that shared experience. So that's been really fun to have with my patients.
Oh, that's so good. I'm so excited for you guys. It'll be so fun. Another thing that this podcast is about kind of health, fitness, wellness. And I know a little bit different right now currently for probably what your exercise routine might be looking like. Jenny and I have talked many times about different workout things and stuff over coffee and whatnot over the years that we've known each other. But how has your exercise movement routine look like, and kind of what type of exercise brings you joy pre-pregnancy and now during your pregnancy? Because I think that is something that is good to know, is that it can change and it's okay.
It has had to change for me. One of the biggest issues I've had with this pregnancy is SI joint pain, or that kind of low back buttock region, sharp pain. So that has really changed my activity level. I'm doing much better now, thanks to the physical therapist in my life, like Lindsay. And so, yeah, I think it's just been kind of listening to my body, what it needs, knowing when I'm probably pushing it too much. Walking has been probably my most consistent form of activity these days. Starting to do like more lunging and like pelvic or like hip opener things, getting ready for labor and delivery. Yeah, I would say at first, my husband is a Peloton fanatic. We have a Peloton, and that was a great way for me to stay active in my second trimester. And I liked hiking too. I'd have to do shorter hikes, but that was also fun. Not doing that anymore too much. But I look forward to getting back outdoors, especially hopefully when the weather cools down, because we're going through a heat wave this weekend.
Yes. Yeah. It's been so hot. So hot. And I know previously you enjoyed like the bar classes and some of those types of things. And history of some dance a little bit too, I believe.
Yeah.
Yes.
Mm-hmm.
What type of dance again did you enjoy doing?
I grew up doing everything under the sun: tap, jazz, ballet, hip hop, everything. But I really enjoy like contemporary lyrical jazz. And yeah, that's been another thing that's, exercise has also been, impaired or affected by the pandemic, the COVID pandemic, and trying to get creative in those aspects. I love doing like group classes. It's motivating for me rather than relying on myself to do individual workouts. So that's something that I have been challenged with, and kind of rethinking my activity routine. So yes.
That's awesome. You'll have to, with your baby, do some dance steps.
Oh, absolutely. I've always joked, yeah, my kids are going to be dancing coming out of the womb. So
I believe it.
I look forward to having lots of dance parties with them.
Oh, that's awesome. So final question that I have for you today, Jenny. So this is kind of a hypothetical question, but you're waiting in line at your favorite coffee shop and a new mother comes up to you and asks you for some advice. What advice would you give to a new mom that potentially would be struggling with staying healthy or finding her new routine as a mother?
Yes. So I think taking time for ourselves as moms or as women, even with the chaos of life, if it's just 5 minutes a day, checking in with yourself, giving yourself what your body and mind needs. So therefore you can have, move through your day in your lives with a little bit more focus and intention. It's so super important. So often I think moms, especially in American culture, kind of give up their sense of self to care for their kids. They, which is great, and I'm sure your kids love it. But it's also super important to be thinking about what you yourself needs as an individual, so you can be an even better partner for your spouse, or partner and for your mom to your kids, friend to your friends, it can spill out into all your relationships if you're really engaging in that good self-care.
That's great. I think that's perfect advice for women and for new mothers alike. Well, Jenny, I want to thank you again so much for joining today for the podcast, and also want to just spread some love and some good vibes your way as you get ready for baby's arrival. So exciting.
I will take it all.
Sounds good. Well, thanks again, Jenny, and we'll be seeing you soon.
All right. Thank you so much for having me. This was a lot of fun.
Thanks so much for listening to this episode of the Postpartum Performance Podcast. I appreciate you taking the time to listen, learn, and grow. If this is your first time tuning in, thank you so much for being here. The aim of this podcast is to provide oodles of the best possible content to help empower women, eliminate the phrase, "I wish I would have known sooner" around pelvic health, and to encourage personal growth through the postpartum journey to becoming the best version of yourself. If you enjoyed the show and found the content helpful, please remember to subscribe to the podcast and leave a 5-star review. These subscriptions and reviews help other mothers discover the podcast. If you're a regular listener, thank you. I encourage you to tell a friend about us or post on social media sharing your favorite part for today's show. If you're looking for more content like this, please follow me on Instagram at Postpartum Performance. Remember, mothers, if you're seeking to live life strong, I'm here with you in your corner. Continue to be brave, stay strong, and live confidently.